Hello, here we are with newborn assessment. Um, Assessment begins right at birth. The nurses answer 4 key questions right off the bat. Is that baby full term, 37 weeks or above? Is that baby crying and breathing when she comes out? Is that amniotic fluid nice and clear, or does it contain meconium stool? Um, is that baby's muscle tone good? Is she kicking and screaming when she comes out? If any of those answers are no, there's going to be some resuscitation going on. With that, we have the Akbar scale, which is the scale that shows how well the baby is surviving on her own outside the mother's womb. It's done at minute 1 and it's done at minute 5. It's scored for a max of 10 possible points out of 5 categories. A well baby will score 7 or above. If that baby does not score 7 after 5 minutes, then every 5 minutes we're redoing that scale until that baby gets the help she needs, whether it be ventilated or moved to the NICU. Um, Respiratory distress in a newborn is an emergency, and some of the signs of respiratory distress would be nasal flaring, retractions as that baby struggles to breathe. A heart rate will be increased 160, above 160. There could be central cyanosis, and a late severe sign would be audible grunting, not just with the stethoscope, but you can actually hear the baby grunting, and that baby has to be mechanically ventilated. um, so as for the assessment of the child, we'll say I have washed my hands and warmed my hands with water. We're going to take this baby and we're going to just get the general appearance of the baby. I see that my skin is nice and supple, soft, pink. Um, she's looking at her face. I see that her eyes are equal, they're even. She's following me. She's looking into my eyes as I speak. She's turning her, her head in the direction that I am in, which is a good sign for hearing, which the hearing test will be done separately before the baby leaves the hospital, but initially, at a quick glance, I can see that she hears where I am. Her nose is nice and equal and centered. To check for patency, you can put a mirror underneath the nose and watch the fogging. I see her mouth. Her mucous membranes are nice and pink, not pale or cyanotic. Um, um, Her ears are nice and equal, and they're not too low set. I'm looking at the corner of the eye. You can almost draw a line to the top of the pin, and that will show me that the ears are kind of where they need to be. Low set ears could be a genetic thing. You know, your family could have low set ears, and that's something that you have to ask the parents about. If not, it could mean a chromosomal abnormality as well. So just something to look at. I'm checking fontanelles. I'm checking my anterior fontanelle and my suture lines. The fontanelles, the anterior fontanelles should close up around 18 months. Posterior fontanelle back here should close up after 3 months. But her fontanelles are nice and not bulging, which can be intracranial pressure, or not sunken in, which can be a sign of dehydration. So her fontanelles are nice where they need to be. A pulse is a normal finding to feel. Sometimes you can see it. Also, when the baby cries, the fontanelles can bulge a little bit, but that's okay because the baby's crying. But it shouldn't stay like that all the time. Her abdomen, I see her chest, her nipples are in line. Her buds are formed. There is no third nipple or anything like that. It would be okay even to see a little bit of discharge from the nipples and as well as from the vagina when we get down there. And that could be just from the surge of hormones from mom. There's no work of breathing. There's no retractions at all. Um, her tone is good. Her muscle tone is good. Get this down here. Okay. So I want to check the range of motion of the baby. So I'm going to turn her head to the left. I'm going to turn her head to the right. She's got nice range of motion. I'm also going to bring her head forward and across and see that she can do that. Okay, so that's good. Her arms are good. I'm going to actually pull her up, and the head will will lag, and that's normal on a newborn baby. A couple months down the line, when I pull her up again, her head, she should be able to carry her own. If it lags, that could be a sign of a neurological disorder. But for now, her head lags. That's okay. I'm looking at that. I'm going to check my Ortolani's maneuver for hip dislocation, which is often an issue. I do this by placing my thumbs on the greater trochanter, and I'm going to abduct her hips to the outside, and there was no clicking heard at all. And my Bartholomew's, I'm just going to go ahead and adduct the hips back, and there should be no dislocation felt. I should feel the ball in the socket. So just going back, I'm looking at my pulses are nice and equal. I'm feeling for my femoral pulses, my brachial pulses. Everything feels nice and equal and strong. I'm looking at my vagina. It's okay to see the labia a little bit larger. That's normal from the hormones again. Anus, I'm looking at the anus, and it looks pink. There's no signs of fissures or any bleeding or anything like that. The umbilicus, looking at the belly button, there's no discharge there either. I'm going to go ahead and take a listen to the baby's little belly. I've cleaned my stethoscope and warmed it up, and I'm actually going to use the other side. And we're just going to listen to the baby's little belly. All 4 quadrants. I'm going to percuss the little belly, and I'm feeling, I'm going to feel for, palpate for any masses, which I don't feel, and I'm going to palpate for any hernias in the umbilical region, which I don't feel that either, and the inguinal region as well. I'm going to listen to the apical pulse for 1 full minute. I should hear beats between 110 and 160 for a normal finding. So as I listen to this for a full minute, I'll also auscultate her lungs. Side to side, and there should be no wheezes. Lungs are nice and clear. I'm going to go ahead and turn the baby over, and I'm going to do the other side, listen to her as well. Okay, little baby. Some of the reflexes that we look at too. We have the rooting reflex, and what we do here is we stroke the cheek. The head should turn to the side that we've stroked, and that is a positive rooting reflex. Also, with a gloved finger, you can put your finger inside her mouth to see the sucking reflex. The baby should have a sucking reflex. Also, the Moro reflex, you can do this. That's a reflex that should startle the baby when they get the sensation that they're falling. Also, with loud noises, sometimes you can clap and make a loud noise. What should happen is the baby should, the arms and legs will extend out as she's startled, and she'll probably cry. And that's good. That's what's supposed to happen. Also, a Babinski reflex, we should swipe the underside of the foot. The toes should fan out. That is a positive Babinski reflex, and that those are all good signs as well. Any negative reflex could be a neurological disorder. And I believe that concludes my newborn assessment. Thank you.